LABAMC, and RIC. Video order, africancollegeofht@gmail.com. A 30th week pregnant woman came in with severe pain in her tummy. Take her history. Explain to the patient what it is and how you are going to manage her history. Trauma. Were you involved in an accident recently? Medical and surgical history. Are you on any regular medication? Have you had any surgical operation in the past? Antenatal. Was there any abnormality reported the last time you had a scan? Explanation. Possibilities: labor pain, fetal demise, placental abruptio, intestinal obstruction, and etc. Management. Analgesia, hydration, blood works, CBC, electrolytes, X-match, and grouping. Urgent scan and immediate referral. To a 30-year-old homeless male presents with a 4-week history of feeling generally unwell with anorexia, weight loss, and intermittent fever. He lives primarily on the streets or occasionally in a men's shelter. He admits to regular use of intravenous heroin for the last 7 years and often shares needles. Given this history, which of the following diagnoses would you consider? Select up to 5. A. Acute pancreatitis. B. AIDS-related complex. C. Aspergillosis. D. Bacterial endocarditis. E. Chronic pancreatitis. F. Delirium tremens. G. Diabetes mellitus. H. Hepatitis B. I. Hepatocellular carcinoma. J. Histoplasmosis. K. Leukemia. L. Lymphoma. M. Osteomyelitis. N. Peptic ulcer disease. O. Pericarditis. P. Pyelonephritis. Q. Renal failure. R. Secondary syphilis. S. Tau pneumonitis. T. Tuberculosis. Answers: B, F, H, O, and T. 3. An 84-year-old female is brought to the emergency department by her daughter, who states that her mother has not been herself over the past 3 days. Further questioning reveals that the mother has been less attentive than usual and more withdrawn. Her conversation is often rambling and she has not been sleeping well. Prior to this, she functioned very well. What diagnoses would you consider at this time? What additional aspects of history would be most important to know? Select up to 4. A. Alcohol use. B. Complete psychiatric history. C. Family history of Alzheimer's disease. D. Financial status. E. History of fever. F. History of incontinence. G. History of osteoarthritis. H. History of Parkinson's disease. I. History of previous CVA. J. Immunization status. K. Marital status. L. Medication history. M. Occupational history. O. Pattern of symptoms over the course of the day, e.g. fluctuations. P. Presence of hallucinations. Q. Previous history of depression. R. Previous seizure disorder. Answers: A, C, E, L, and Q. Differentials: acute confusional state, delirium, Alzheimer's, and etc. 4. A babysitter brings a 14-month-old to emergency because of inconsolable crying. The child appears well cared for and healthy, but a bruise is noted on the left humerus and a well-circumscribed small fresh burn is noted on the other shoulder. List 4 well-recognized risk factors for child abuse. Which of these physical findings are most suggestive of child abuse? Select up to 4. A. Bruises on shins and elbows. B. Buttocks wasting. C. Caput medusa. D. Clubbing. E. Condylomata acuminata. F. Eczema. G. Full fontanelle. H. Healed laceration on chin. I. Hutchison teeth. J. Impetigo. K. Large purple macular lesion on buttock. L. Limp. M. Oral thrush. N. Petechiae. O. Pitted fingernails. P. Proptoses. Q. Retinal hemorrhage. R. Seborrhea. Answers: A, H, K, L, and Q. Risk factors: broken home, postnatal blues, economical status, aggressive disorder, and etc. 5. A 30-year-old woman comes to your office with 3-day history of vulvar and vaginal pruritus. What features on the history would you inquire about to make a diagnosis? Choose up to 7. A. Date of last menstrual period. B. Sexual history. C. Vaginal discharge. D. Vulvar erythema. E. Vaginal odor. F. Recent antibiotic therapy. G. Diabetes. H. Macular rash. I. Psychiatric history. J. Headache. K. Allergies. L. Dysuria. M. Use of douches. O. Previous history of STDs. Answers: B, C, E, G, K, L, and M.